Awesome. Well, let's go ahead and get started. And I know folks will join as we continue. Definitely want to encourage people to ask questions as we go, and um, we can kind of take them as we go. But today our conversations about benefits in the nonprofit space, particularly as you have mission-driven alignment around what you're offering, but also want to make sure you're maintaining the right culture. And there's not always a lot of money to go around. And so we thought we'd talk about this today, and I'm super excited to do it. Let me walk through the quick agenda, and then we'll do introductions. So we've got a great agenda for you today. Obviously, we'll start with introductions, but then we're going to go through cost containment and making sure that you're aligned on your benefits with your mission and spotting overspend, funding strategies. And then we would love questions throughout. Go ahead and just throw them in the chat. And we'll stop, but we also will just make sure that we make time at the end for Q&A. So my name is Amy Frampton. I lead marketing here at Nava Benefits. And I'm so excited to talk with Julia and Vivian today. Ladies, would you like to introduce yourselves?
Sure, I'll kick it off. Hi, everyone. I'm Julia Arant. I'm a partner here at Nava Benefits. I've been here a little over a year and 2 months, but I've been in the industry 20 years. Was with, sort of large national global firms prior to joining Nava. I really came on board because Nava is challenging really the paradigm with respect to benefits and really modernizing the experience, but also bringing great strategy to the table and so on and so forth. I have a long history of working with nonprofits. It's been, the majority of my book of business for many, many years, and that was very intentional on my part. I chose to align myself with mission-oriented organizations because I like marrying my business acumen with my own sort of morals. So really happy to be here, happy to talk on this topic that I'm very familiar with, and nice to meet everyone. I'll kick it over to Vivian.
Good morning, everyone. I'm Vivian Wan. I'm the CEO of a mid to large size nonprofit in the San Francisco Bay Area. And our mission is to end homelessness. And we're actually three different nonprofits, and this is relevant in this discussion because we have two that are on small group plans and one on a large group plan. So, really, making sure that employees that do the really hard work of ending homelessness one-on-one with our community members are supported by our organization is a key value that we own. If anyone knows the Bay Area and the country, we're struggling with this really challenging housing and homelessness crisis. So our work is more important than ever. And altogether, we have about 800 employees in our three organizations. So I'm really delighted to talk to you today. Julia and Amy know this, but I am not an HR professional. I'm a CEO, so making, these choices, we really count on brokers and other HR professionals within our organization to lead us and then, make the hard decisions that need to be made from a nonprofit perspective. I've worked in my organization for almost 20 years. So I've seen it grown from a small 40-person agency to an 800-person one, and have lived to see the changes that's meant from an employee standpoint.
I'm really excited to have you on the call, Vivian, because it's important to the whole company. And now as the CEO of Abode, thinking about everything from finances and costs and culture, I think it's going to be an excellent perspective. So let's dive right in. Talk about cost containment. Julia, do you want to kick us off here? I mean, such an important thing for all of our clients at Nava and at other brokerages, but particularly right for the nonprofit.
Yeah. So, I think I'll start by saying that nonprofits are obviously very deeply committed to their employees, and oftentimes benefits are a really big part of the overall spend on compensation. So benefits are a huge investment. And I think one of the things that we see when these investments are being made, that sometimes the investments are not necessarily understood by the employees or recognized. And this is not because employers are not making an effort to get good communications out there, but there are still things that people just don't sort of grab onto. So I think the first potential like missed opportunity when it comes to cost savings is just making sure that your employees kind of understand the benefit package. And then also that they understand sort of what's embedded in the benefit package as well. So I know this sounds sort of simple, but sort of tapping into the existing portfolio to make sure that you're promoting programs. So embedded resources, thinking about things like mental health, wellness, discount programs, things that are sort of already baked into the existing portfolio, and really just promoting those so that you're not making duplicative investments in other maybe standalone programs and things like that, can be a very powerful cost containment strategy. I think when I was a kid, I was always told a penny saved is a penny earned. So that's sort of this approach to looking at sort of what's embedded in the existing programs. And then really just coming up with a good, again, communication strategy to get in front of the employees on those benefits, whether that's through things like in-person health fairs, push notifications, emails, or things like personalized benefit apps that are really again personalized to each employee, to really just again promote engagement with those embedded programs. I think when I think of groups that are sort of like doing direct service work or doing clinical work or anything where you're not sort of tethered to a desk, a good way of getting messaging across about your existing benefits portfolio can be through things like apps and other creative sort of innovative technologies. And then lastly, I would just say like tapping into your broker and just really making sure that you're keeping them accountable, tapping into any value-added services that they have, even things like sponsorships. They might have HR compliance platforms available. Just make sure they're keeping you on tabs, of course, with compliance in general, just so you're not, paying penalties. So things that I can, for example, at Nava, most brokers actually do offer this. We offer mineral free of charge to our clients. We are sort of helping them keep tabs on compliance as well. And then we happen to offer Headway. Similar to Headway, you might find that embedded in your medical program, there is, self-directed self-care apps and mental health supports, things like that. And then just lastly, making sure that your broker is sort of negotiating with carriers on your behalf for anything like wellness dollars might be available, tech investments. These things are typically available to groups depending on the carrier and depending on the size. And then another thing to think about, I know I'm throwing a lot out there right now, is just making sure that the compensation model that you're paying your broker is appropriate. So if you're paying a straight commission model, just bear in mind that, as your rates are increasing every year, their compensation is increasing. So think about, perhaps negotiating something like a PEPM compensation model for your broker. So these would all be sort of like low lift cost containment strategies that don't even require really any marketing. It's really just looking at the investments that you're currently making and really promoting them. Any questions on that? I know that was a lot. Vivian, did you?
Definitely want to encourage people to add questions into the chat. We'll definitely get them answered.
Yeah, I mean, Vivian, have you had any personal experience sort of from your HR team with like promoting existing programs and sort of seeing that in practice?
Absolutely. First I want to comment on, this really using your broker to the maximum extent possible. In our organization, our brokers are our partners. We call out, whenever we're facing sort of a challenge, we will reach out to them. So like if you, for the attendees, if you don't know like the principal of your broker, as an executive, we have access to not only the folks that are really doing, the day-to-day work, but if we have an agency challenge, they're one of the first calls I'm making. So if you're not using your broker in that way, I'd really encourage you to think about that, because they are there to not only provide benefits, and of course they get paid, but also to serve you. So the best organizations do that. In terms of making the most, it is so hard to survive as a nonprofit employee, particularly anywhere I would expect, but in the San Francisco Bay Area, you can imagine how difficult that is. Most of our workers make under $70,000 a year. and if you can imagine how hard it is to live here. So, and they don't actually get retirement benefits and other benefits that, say, government employees get. So really, we try to make use of our benefits plans to the extent possible. Because we work in such a high stress, high mental stress field, that we have a lot of clinicians, a lot of social workers, a lot of folks who do mental health work. And they are asking for a lot of mental health services. And we, like many, I'm sure, on the call, use Kaiser and Sutter. And historically, we've had, Kaiser is pretty well known for providing subpar mental health services. So internally, we've had staff actually through our QI team, our quality improvement team, create trainings for staff on how to really access Kaiser benefits, how to get to the services that you need from a mental health standpoint, instead of, everyone having to navigate that on their own. Because, in mental health world, EAP services aren't as useful to our clinicians that frankly have a higher degrees in mental health than many of the folks that are being called on the EAP line. So really how to access those deeper level mental health services that already are in our plans instead of having people pay outside, which of course mental health services externally can be extraordinarily expensive. So that's been a real benefit in our organization, using our internal resources to train everyone to access our existing plans.
That's great.
Yeah, it's that alignment of what your particular nonprofit base needs, and as you said, they're looking at government roles, they're looking at other roles and kind of what might be standard, what might be expected, and then there are mental health additional needs in a nonprofit that there might not be at other places. And so how do you, think then about nonprofits, Julia, either overspending or being misaligned in that way?
Yeah, so I think this is especially for groups that are very generous with contributions, which we often see in the nonprofit space. So, they're offering, generous contributions maybe to employees, and then also generous contributions to dependents as well. I think one of the very easy things to do is just sort of make sure that there's not data errors occurring when you do have this rich contribution strategy. So if you think about someone being left on a plan, for example, when they should have been terminated, or maybe a dependent on the plan that's not eligible, that can result in a spend of tens or hundreds of thousands of dollars in unnecessary spend in a year. And just how do you recover those funds? How do you identify those errors? So one kind of starting point would be just doing audits. And I know that sounds pretty intuitive, but leaning on your broker actually to be a partner in that process can be helpful. And just really having them be sort of a data partner in general. I think anyone on this call who has dealt with benefits knows that even when there are carrier feeds in place and feeds directly from the carrier, from the enrollment portal to the carriers, those do break. And unfortunately, those errors can result in a lot of extra spend. So making sure that you have a broker that's sort of keeping tabs on data, whether they're doing your benefit administration for you or they're just keeping an eye on discrepancy reports, is really helpful. We take it a step further and actually do audits on behalf of our clients, especially during those sort of inflection points during the year when there, a lot of data can get lost, which everyone on this call knows that would be, past open enrollment, or if you do have any big hiring freeze throughout the year. So another common issue that we see in that arena would be EOI. So when people are electing coverages for life insurance that are above the guaranteed issue amount, this is a really common area where that can get lost in the mix, and you may be taking out the wrong deductions for employees in that position who maybe haven't been approved or haven't completed their EOI. So just having, again, a broker partner to sort of take some of that off your plate by monitoring data accuracy. And then a last one, and this is not going to be necessarily applicable to every single client, but if you're a larger group, doing a dependent audit can be another way of catching overspend, and just making sure that the dependents that you're covering on your plan are actually eligible dependents, meaning, you don't have employees covering, cousins and parents and folks who generally would not be permissible to cover on the plan. So those are some ideas for just kind of catching overspend. Again, auditing both for data within the systems, but also for dependents who should not be covered.
Vivian, tell us a little bit about how you might be and your team, utilizing some of these tactics with in your broker relationship and just making sure that there's not, those valuable dollars aren't flowing out in the wrong direction.
Right. We do these audits all the time, and our brokers support us in that. And I think that even above that, for anyone who has used the system knows that I appreciate Julia saying, the data feeds break, like regardless of what superstar system you use, that sometimes the system works for us and sometimes it works against us and creates more actually work on the HR side. And from my standpoint, anytime that HR is head down, in data means that they're paying less time to the actual employees, and yet we want to do that from a cost perspective. So we really lean on our data systems and our brokers to support that effort. In as much even we've asked our brokers to support us in the RFPs, so requests for proposals for data systems. So they've actually led that search on sort of a coordination, a project management level. And their connections with these other systems sometimes gets a faster response than Joe Smo nonprofit. So they use their influence with all of their many customers, that use the respective systems without having any undue influence on which system we're picking, but helped us with the criteria for choosing, help us with the getting the people to the table, help us with the negotiations after we select our, final couple. And then also, your broker might also have technology, I don't know whether it's called technology sponsorships or whatnot. They might actually be able to help you transition and provide a $10,000, $20,000 sort of support, because we know any sort of use of technology is going to take a pretty heavy lift for your team. So there's lots of areas, because we don't want to be so head down in the data that we're not looking up and serving our employees.
Yeah, I love that. Anytime that HR is spending time on that, they're not serving the employees. That is so key, right? And my guess is you don't have a huge overstaffed HR team with all sorts of time. Viv, is that true?
Yeah, and I mean, for my nonprofit colleagues, they know that HR is what's considered overhead or admin, and
Yeah.
no one wants to fund that, right? So, all of our sort of finance departments, our human resource departments, that sort of piece. So we are kept extraordinarily lean, by nature of nonprofit funding, right? Because there are all sorts of arbitrary limitations on how big your back office should be. So we have to use every dollar so carefully, and often we have to make choices of, is this data totally clean? How much time do we have to spend on it? Versus like this really tricky termination that we're dealing with, or this really this other issue that's not necessarily benefits related.
Yeah.
I really appreciate that. And one of the things I wonder about is how do you utilize data or other practices to understand what your employees are looking for, Vivian, and what they need, how they would prioritize, knowing you probably can't do everything, um, for them. How do you think about kind of getting the data that you need to make those right benefits decisions?
Right. Thank you for this slide because it cuts to the chase. Benchmarking is really, really important for us because for my colleagues on the call, I'm sure you hear, well, so and so provides this. They cover, their whole family at no cost, or, of course, pay and whatnot. So employees are there's some data point that Gen Zers are like looking for a new job like 40% of the time, something crazy, right? So everyone is always looking for something else. So it's really important that we benchmark data. And honestly, our brokers are wonderful, but at first they brought sort of general business benchmark data, right? And then we narrowed it to sort of nonprofit. But then I actually said, look, our employees are looking at, nonprofits, but where they go to if it's not nonprofit is government. And we know that despite we can't compete with government on some things, pensions and that sort of thing, we want to make sure that we know how far off, and frankly use it in negotiations with government, right? Of saying, okay, in our contracts, if we increase our benefits to 30, 35, percent on top of the FTE, versus 25 or 30%, how does that compare with what you're paying? Right? So knowing that, it helps us design our benefits portfolio and pay for it through our contracts as well. So our benchmarking includes nonprofits, it includes government, and then sort of the general business in our geographic area. And that sometimes, quite honestly, it's depressing. Like you see it and like, oh my gosh, I cannot do that. There's no way that, our contracts will allow that level. But I'd rather know about it than not know about it, and incrementally get there, and gives us that ability to have those negotiation conversations so that we know where we're going.
I love that. And Julia, I know you work with a lot of nonprofits, so I'd love to hear your thoughts on kind of what you suggest and how you support that.
Yeah, I mean, I think first of all, Vivian raises an important point about like making sure that you're benchmarking against the right data sets, because it's you want to make sure that you're benchmarking against whatever industry you're competing with, right? That might not always be nonprofit. To Vivian's point, in her case, it could be nonprofit and government. So I think that's a good jumping off point. I think it's really important for any organization to ensure that the investments they're being made or that they are making are actually meaningful to the employees, so that they're not either misaligned with the mission or you're not like over investing in things that, like to Vivian's point, your broker said, okay, well, here's just general benchmarking. This is what we see groups liking, but actually very tailored. So you're not overspending on things that are irrelevant. So we do that through benchmarking. All the major benchmarking resources that a lot of brokers use, we're using as well. We're also helping our clients with surveys to sort of help not only gauge employee attitudes, but also figure out, a survey isn't always just to say, okay, what do you want? It can also be to identify knowledge gaps. So you might do a survey and find out that your employees don't even know that you offer a certain benefit, or they're just really not invested in it or engaging with it. So doing that as well as engaging in benchmarking can be a good combined exercise. And I also like to think about not only the benchmarking and the surveys, but also input on our end from our HR advisory team. So here at Nava, we have an HR advisory team. We also have a solutions consultants team here. The solutions consultants team really is like, they're there to sort of like dig into like, what are the emerging perks? What are the emerging trends? Go to all the industry events, like see what's new and out there and really bring it to the partner team. And we're also, of course, actively engaged in that, but it's nice to have a solutions consulting team that's kind of all they do. And then our HR advisory board is, high level folks from, Fortune 500 companies who are really helping us bring sort of that enterprise level thinking downstream, which can be relevant to both for-profit and nonprofit. But yeah, I think gauging employee attitudes, also finding things like reallocating funds. So something that might come out of a survey is that you find, again, that someone is not utilizing a perk or not engaging with it. Maybe shifting gears and sort of pivoting to something that either crosses broader demographics or meets a broader need, something like a lifestyle savings account instead of a very targeted benefit where it can be applied, broadly, or even something like a personal assistance, like an overalls, if you guys have heard of that, might be more meaningful to your employees and could actually eliminate other like sort of point perks that you might be engaging in and just sort of consolidate that into one investment. So those are some ideas that that we've used in practice with our clients.
Yeah, understanding what others are going to be doing, and then utilizing that benchmarking. I know you've got that up on the screen as well. Was there anything else you wanted to share here? I love the term
Yeah,
innovation scouting.
yeah, no, I mean, I think like there's a couple of things. I mean, I think that the innovation scouting is sort of what that team, that solutions consulting team is there to do, right? They're scouting innovations and bringing them to us. But lastly, like I would arrogantly say that well, I think that we are trendsetters really here at Nava. I mean, that's really sort of part of why I joined the organization, because we're bringing interesting tech innovations that are actually informed by our clients. So we're asking them, what more do you need here? And they're feeding us that information. We're like continuing to innovate based on that feedback. So yeah, I think this kind of covers it. And then just wanted to provide a snapshot of sort of how we help our groups craft employee surveys. So again, making sure that you're using this as a tool not only to gauge employee attitudes, but also to identify knowledge gaps.
And this survey is available on our site. We also will send it up as a follow-up to this webinar. It's totally free and kind of a nice, easy way to get that feedback. Great. So let's shift gears to strategies. These are things that can sound big and scary. So I'm excited we're going to dig into them and share some ways to do it. And this is all around plan design and funding strategies, which nonprofits, need to look at in the same way that a for-profit does. Julie, I know you work with a lot of nonprofits on this. You want to kick us off?
Yeah, sure. So I think, it sounds very simple, but simply making sure that your broker is actually getting competitive bids from the market is a good jumping off point. And I know that sounds very simple, but sometimes there is a bit of a reactive response to renewal time, bringing you your renewal, saying here are the market conditions, what can you tolerate, et cetera. So just making sure that your broker is really engaged in sort of like a no stone unturned approach to marketing just in general. Offering, again, competitive bids so that you can sort of pit the carriers against each other, for lack of a better description. And then, provide, contribution modeling, insights on things like bundled discounts, again, doing sort of a benefits audit and uncovering duplicative investments as well. Those would be sort of a jumping off point. But beyond that, there's a lot of different cost containment strategies that you can look at, including a broad spectrum of sort of benefit and funding strategies. That can provide actually meaningful savings to a lot of groups. So low lift and sort of low on the funding spectrum, which we do have a slide that sort of shows the funding spectrum that's coming up next. But some sort of low lift strategies would be, putting in a high deductible health plan and offering an HSA contribution, some sort of funding on behalf of the employees, but then taking that a bit farther. I know most people are familiar with that concept, but you can actually take it a bit farther by also putting in an employer paid indemnity plan. So what you're doing there is you're pairing the high deductible health plan with the HSA funding. Some carriers don't like you to fund the HSA too much, so they won't let you put in, the full deductible or the full out-of-pocket maximum. So you may be limited there. You can actually make your employees a little bit more whole by actually layering in an indemnity plan and paying for that. So that if your employees do still have some out-of-pocket exposure, that they can actually file a claim through the indemnity plan and actually maybe be made entirely whole, in fact. So that's one strategy that I'm not sure that every broker is talking about. And just for those of you who are on this call and aren't familiar with indemnity plans, that would be something like you could do like a hospital indemnity, critical illness plan, something where if employees have a major hospital event or a diagnosis, that they can file a claim and get made whole. Another step on the funding spectrum that's sort of a lower lift would be a MERP plan, a medical expense reimbursement program, or an HRA. They're slightly different. But this essentially allows you to adjust your contract, similar in the way that you would do to a high deductible health plan, put in higher benefit attributes, meaning that employees would theoretically pay more out of pocket if they visit the doctor, which conversely, drives your premiums down, of course, and then fill in the gaps with a gap plan or a medical expense reimbursement program. This also allows you to have a little bit of insight to utilization. So if you're a smaller group and really haven't had exposure to utilization because you're not a credible group, this is a way to sort of open up some access to that information. Another common challenge that we see, particularly in Northern California, and I think this will probably resonate with Vivian and others who are in our area, is that we do tend to see high Kaiser penetration and high HMO penetration in Kaiser in particular. In Northern California, what we often see is like sort of slice business or just Kaiser as the sole carrier and groups kind of struggling to offer something other than Kaiser. So sometimes they'll look at things like, oh, let's do the Kaiser PPO plan, which those are very expensive. Or God forbid, not even make an offer of coverage to people who might be in areas that they don't have access to Kaiser, or maybe they have executives who are looking for things other than Kaiser. A good idea to pair against a Kaiser plan would be something like an ICHRA. For those who are not familiar with ICHRAs, it's individual coverage health reimbursement arrangement. There are some really great vendors out there that offer these and support them very well in ways that sort of resonate with Nava in the sense that we're high tech and they tend to be high tech and have very good support for members as well. So you can often layer in those ICHRAs alongside a Kaiser plan to avoid, again, paying for a PPO plan or even paying a penalty. And then lastly, there's a broad range of, funding strategies that are much more complex than this, which I actually will go into in the next slide. But if you're a group that's sort of thinking about funding strategies, but you're a little bit scared to really dip your foot in to the medical, you can start by looking at self-funding dental and vision plans. Those come with very low premiums overall and much lower exposure. So it's a good way to get exposed to self-funding without really diving in and taking on the full risk. Vivian, have you guys looked at this? I know that you guys have Kaiser and Sutter today. Have you explored any of these options?
Yeah, we've definitely explored self-funded captive plans, not only the ancillary, but the full.
Yeah.
We've had a few years with some very, extremely high premium increases and extremely high usage on, for a few folks, right? In our large group plans that have sort of driven sort of the maximum increase, which is really hard to absorb as an organization.
Yeah.
I think, as a nonprofit, and I'm so curious as to, the businesses of the other folks on the call, but my advice to nonprofit leaders is to lean into the complexity, right? So, Julia, says these like she was born knowing about all of these, ICHRA and all of these acronyms, and all of us in our nonprofit settings have our own sort of cadre of acronyms and knowledge base that, I could bore you all with. And, when we hear some of these as nonprofit leaders, whatever field you're in, it's easy to sort of tune out and just say, I just need health and dental and whatnot. So I would say, use your broker, ask the question. And as a CEO of I really do know what I'm doing in my business, it's hard sometimes to say, what is that? Can you tell me what that is again? Can you explain it again? Can you explain it again? It takes us a few times to really understand it because it's not this insurance world is not our world. And some of these things can be really, really beneficial. And, it's important that our HR professionals know as well. But, I'm always thinking of how to provide the most value for our employees within the budget constraints that we have. And honestly, switching over from Kaiser to something else would create so much instability within our workforce that there are some non-negotiables, right? Like I am never going to do that, right? Because 80% of our workforce, elects to use Kaiser. and about 20, Sutter but there are some non-negotiables in my mind, and just be clear with your broker about what those are, and then ask them to come to you with creative opportunities to add value to your benefits plan within your means. So, I mean, they'll come. I had I've been begging for like additional mental health resources for years and years and years. Every year they come, with because the field has changed dramatically on the types of resources and the cost of those resources. And even if I decline for one reason or another, they've come the next year with something else, or the same year sometimes. And finally, this year, there's something that we really think will be beneficial, that it's not cost prohibitive. And we're going to see what it means for our employees. So yeah, that's my advice of, we've looked at some of these, and honestly, we've gone sort of the traditional route in most cases, but it doesn't mean that someday that we won't.
I love that point, Vivian, because I think that's a multi-year strategy,
Right.
right? It's like looking at this on a more long-term, from a more long-term lens. And, I think we get started very early in the year talking about strategy. And I think the way that we build a strategy is we first start the conversation on like long-term, where are we trying to go with this? Like, what is the 3 to 5 year plan? And then hone in on short-term objectives and sort of start pre-renewal, again, surveys, benchmarking, like looking at market conditions and trends early in the year to sort of paint that picture and that short-term path. But in that process, we are bringing ideas to the table that might not fit the budget in year one, or might not be, might be too scary, to your point, Vivian, in year one, or you're not ready to execute on it because you have other priorities, but at least you have the data. Like, you've got the information to inform future decisions. And I think that's a really good point. Just making sure that you're looking at stuff that may not hit immediately, but is good to be considered down the road.
Yeah, and I see,
Yeah.
and I don't know, Amy, there's a question in here from Katie, who has 600 employees, and uses a self-funded, and people hate the deductible. This is something we've really struggled with, even as the plans have become more expensive. Even in the Kaiser plans, we've had to add that base level plan with a deductible, yeah, and I mean, just for our employees, like, $2,000 is a lot of money, right? I mean, like that can put really employees under. So how, again, we haven't moved to a self-funded plan, but to me, it's the deductible piece that is the challenging part of that, to have to pay $2,000 really first. So what we've done is we've put that next plan, the buy-up plan, as low cost as we possibly can, because we really want to encourage people to go with that, so they're not stuck with high deductibles if something catastrophic should happen. So that's the way that we've dealt with it. We've tried to encourage people to go to that middle plan and kept it as low cost. So our employer contribution to that middle plan is actually more than both the lower plan and the plan above that. So we try to drive people there, but we don't self-fund. I don't know, Julie, you probably have more to add on that one.
Julia,
Yeah,
I'd love your thoughts on this.
Sorry, what was that for me, Amy?
I was just going to say, Julie, I'd love your thoughts on Katie's question.
Yeah. I mean, it would be interesting to see for the group in question that put that question into the chat function on that, deductible. I mean, you can do contribution strategies where you're encouraging enrollment in a plan that doesn't have the deductible, and people will opt into the higher deductible plan because it makes sense, because of the cost for their families, or whatever that the case may be, maybe adding dependents. But there may actually be ways of filling that gap. I'd be happy to talk offline with that person about potential strategies for addressing that gap. Like, is it a plan where, okay, and they do cover the first half of the deductible by using an HRA. So it's possible that you might be able to layer a gap plan in alongside that. So I would be happy to, again, talk to you offline about that. As far as benchmarking, would be also happy to talk to you offline about if we wanted to look at a benchmarking report. Okay, Katie, I'll give you let's connect. We'll connect after this, and we can talk about looking at benchmarking to see sort of where you guys stand, and then also talking more about any potential potential opportunities to fill that gap.
Sounds like there are options. Yeah, that will be
Yeah.
great, Katie. Um, Excellent. Well, I know we were then going to go kind of in, we talked about low lift,
Yeah.
and then we started to kind of get into multi-year strategies, and Vivian definitely is thinking that way. Julia, do you want to dig in a little bit on the multi-year strategy piece?
Yeah. So again, we talked like very high level about the funding spectrum, but it's pretty broad. So I mentioned already that there's a lot of steps along here. The baby steps that we kind of covered here would fall into like gap funding. I would say technically a high deductible health plan with an HSA is still a fully insured plan. So that would really fall into like this sort of orange pink area up front we've already sort of covered, but and those are concepts that could be implemented pretty quickly. Like, if you are a 7-1, I know we sort of, when we put this webinar out there, we said, hey, ideas that you can implement before 7-1. I would say that, HSA, gap funding, MERPs, all of that's feasible on a short-term basis. But if you want to get a little bit beyond that, if we're talking about level funding, I will say I've moved people into level funding in a short window, but there are some other steps on the funding spectrum that take a little bit longer to implement. And that's really where that longer, that sort of long-term strategy comes into play, or that multi-year strategy. I will say that all the concepts on this slide sort of do require employee education. We should lean on your broker to really spearhead that and take the lead on building communications and coming up with a good strategy to support these concepts so that they are successful over time. So anyway, when we get into funding strategies that are a little bit more progressive, level funding would sort of be that first step. So for those who are not familiar with level funding it allows you the opportunity to pay fixed monthly costs. So you're paying a fixed premium, just like you would with a fully insured plan. But if you have good experience, so you perform well, essentially your population is healthy, you get a return of premium at the end of the year if you do have some surplus left over. If these terms are not familiar, I apologize. Again, anyone who wants to talk offline about these concepts is welcome to set up a call with me. But that allows you to design, in some cases, if you kind of like unbundle in a level funded environment, you can also design custom networks. You can engage directly with PBMs, which are pharmacy benefit managers. You can even target like high cost drugs. I have a group that I put into a unbundled level funded program late last year. And they only had 60 employees, which most groups don't think of, gosh, funding strategies down to under 100, but they're coming downstream heavily. For that group, we were able to identify a high cost drug, and we were able to internationally source it, and it was a win-win. So we got the employee a $0 copay. We saved the company hundreds of thousands of dollars. So that's just one example of how level funding sort of open up access to data, especially in states where we don't get data as much as some other states do here in California, but also enable you to really use that data as a tool for cost savings. So whenever you're going to think about concepts like this, what you want to know is that your broker partner is able to help you look at things like a feasibility analysis, look at your claims history, talk to you, and get kind of all the stakeholders in the room to talk about risk tolerance. With some of these funding strategies, there does need to be buy-in from multiple stakeholders. You need HR buy-in, but you also typically need finance to buy in as well. And that's a lot of buy-in, but it can be very significant. Some other steps on the funding spectrum, captive, Vivian mentioned that is also a form of level funding as well. And again, with all of these concepts, you can like reprice prescription drugs. Like it just gives you a lot more freedom and control over again, what you're paying, because you're essentially paying your own claims. I will say, as I mentioned earlier, that these concepts are growing in popularity even with smaller clients. I know it can sound scary, but as long as you have a good, broker partner there to support you, these can be very successful strategies. The other thing I will mention is that, again, when you lack credibility and you haven't historically had access to data, you might think, well, how do I go into these with my eyes wide open? But with the advent of like transparency legislation, it really is kind of shifting the market a little bit. So there are now tools out there that can model your risk by scrubbing big healthcare databases, pardon me, and sort of generating predictive risk profiles. So even if you think you're not credible, which even if you're not credible and you don't think you can have this data, sometimes just the process of quoting these solutions will actually get you that data you need. So again, I know these are sort of, these are pretty progressive concepts, so it can be maybe intimidating to hear me talk about them, but to Vivian's point, we generally, if you are sort of in this green and beyond on this spectrum, it is a multi-year conversation. Just rest assured that no one's going to push you into this without the right data and the right buy-in.
That's helpful. It does seem scary. It can seem scary, but if you've got the right partner, it's a lot easier.
Exactly.
Yeah, the only thing that I'll add, Julia, you sort of said it early on, is that that any strategy, what you're doing now, or if you're going to do something bold, requires a lot of employee engagement and communication. Yes. And I do think that that's a great great way to partner with your broker. And it's important that you take whatever your broker gives you and put it in your own sort of cultural language, right? Because our broker firms have their own culture, as do we. So I'll give an example. I had this, frankly, we weren't doing anything fancy here, anything bold, but we, just in our regular open enrollment, the employee contribution increased by like 2.4%. So of us in nonprofit, like that is like amazingly low, like, because we have double-digit increases year over year that the agency is absorbing. So 2.4% didn't mean, like, I thought that was great, like, but what that meant in our organization, we really we put most of our value on the individual employee and employees with children. So our plans are more rich for the employee and those with children. And where we don't put a lot of extra dollars is in spouses. So any family plan that has a spouse, or just the spouse and the employee. So we pay at 50% there, and up to 85% of those with children, and 100% for just the employee only. At any rate, this employee was really upset because it increased by like $13 for her, which to me didn't feel like a lot, even though, I mean, she was a lower paid employee. But I took the time actually to explain why we do the things we do, right? The values behind, like, of, basically wanting spouses to be covered through their own employer or in the open market, because it's frankly less expensive to do that than it is to put on our plan. And she got it, right? So this is just like a microcosm of the things that we don't think that we need to explain, of the decisions, the value driven decisions that we're making, for better or for worse. Our employees really appreciate it when we do the why behind the decisions we make, whether it's the existing, what you do and what you can't do. And in our pre-call, we were talking about full cost compensation, or full compensation viewing, right? So employees don't often understand that it's not just the rate of pay that we're paying, but all of these other costs that we are contributing, for the employee experience. So how we describe that, not only in a, see, we provide a lot for you, but in a understanding how our values of the organization meet with the values of how we treat our staff. So that's like over communication. I should have just said it in those three things. Like, if you think that folks understand, they probably don't, or a lot of them don't. So over communication. And that's hard for organizations like mine, where we're so busy all of the time. But people really, really appreciate the why behind what we're doing.
Yeah, I think that's super important. And I would argue that your broker should really be helping you with that a lot. I mean, I totally agree with what you're saying, Vivian, that oftentimes the language spoken is different. What's interesting, I think, at Nava is, like, we have the distinct advantage of we weren't started by benefits guys. Like our two founders didn't really come from the benefits space, but were very passionate about it due to their own healthcare circumstances and so on and so forth. And I say that to simply point out that we are, they acknowledge that this is not a language that everyone speaks day in and day out. And so we have a lot of sort of layman's terms built into our communications, built into our app. Our benefits advocates are like dedicated to employees and education and advocacy, and just really helping employers, yeah, exactly, like craft, whether it's putting the context of your increases into putting your increases into the context of like what's happening in the broader market, or what's happening in the broader context of like what, again, total compensation at your organization, and helping support those efforts. I couldn't agree more.
Well, we know a lot of nonprofits renew on 7/1. It's coming fast. And so, Julia, I would just love kind of your pro tips.
Yeah.
What should folks be doing before the renewal?
Yeah, so I think first and foremost, just looking at like sort of doing a benefits audit of your existing benefits and just making sure that you're promoting everything that's embedded in your program. So looking at your embedded benefits with your broker, making sure that there are not duplicative investments being made. Again, just sort of like honing in on, what's being utilized and what isn't through again, things like gathering data, surveys, acknowledging, knowledge gaps and so on and so forth, to make sure that the existing program is tight. Also, July 1 is right around the corner, but making sure that you're going into marketing with good data by conducting a good systems audit. So looking in pre-renewal at doing an audit of your systems, making sure that you're going to market with good data, comparing apples to apples as you're going to market, again, so that you have good information. Conducting a dependent audit could be a good exercise as well, just to make sure that you're not covering people who shouldn't be covered under the plan. And then, evaluating some of those early steps on the funding spectrum, I think would be a viable opportunity between now and July. So things like MERP, putting in indemnity plans if you're already doing a high deductible health plan with employer funding, having your broker engage in some contribution modeling around that. And then, this is getting a little bit ahead of ourselves, but post-open enrollment, starting the conversation early in the year around some of those more complex funding strategies to see if doing a feasibility analysis makes sense in preparation for the next plan year. I've mentioned a couple of times we do pre-renewal like almost in lockstep with post-open enrollment. So we're closing out open enrollment. We're pretty much getting into pre-renewal right away. So we have a good runway to explore those. And then just lastly, and I think Vivian, pointed this out a couple of times in the presentation, like if your broker isn't being proactive, if they're not being a good partner to you, if they're not only helping you with strategy and audits and innovative communications, but also like being really transparent about compensation and being willing to have conversations about that, and sponsoring programs and asking the carriers for tech investments and wellness dollars. Just make sure that they're doing those things. They really should be bringing those concepts to you, not the other way around.
Absolutely. That partnership really year round is so critical. Well, we have just a couple minutes. This has gone really fast. Are there, Viv, any pro tips you want to, before renewal, you want to share? We also can ask for questions if more questions come up.
No, I think Julia covered it. And I mean, the only sort of nonprofit perspective I have here is, and each nonprofit is set up differently, but ours is often through contracts. And, sometimes our contracts, it's easier to add on the benefits side than other places, right? Because our funders will allow that, right? So like sometimes we are needlessly scarce on our benefits when we can actually add that in and have that conversation with our funders and say, nope, there's a 8% increase because we needed this, or because this is the market, or because. So sometimes we don't have to skimp where we might sometimes think, depending on your relationship with your funder, because they also they live in the same market, right? So they know that benefits costs are increasing. And sometimes I've been surprised. They've actually advocated if we've added, oh, that's great. Your employees really need that, so they've backed those decisions. So make sure that you're making financial decisions that actually are real, because the same type of money isn't always the same type of money. It depends on where it goes as to will it be funded.
Mhm.
Appreciate that. This is such a important conversation. Really appreciate Julia and Vivian spending their time with us, and everyone that joined us. This will also be posted. It was recorded. It will be posted. You can definitely go back, and we'll be sending out a link to that along, excuse me, with our survey. Thank you so much, everyone, for joining us today. And again, to Julia and Vivian, thank you for your expertise. Greatly appreciate the conversation.